Hi friends, I am Dr. Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. So today let us discuss about the most important tips in breastfeeding. So basically breastfeeding is the most important nutritious diet for the baby, and let us know about some tips in breastfeeding. So first and foremost tip is the colostrum, importance of colostrum. So colostrum is the initial milk which is secreted from the breast. It is usually thick creamish white, and this colostrum is a rich source of antibodies, and it contains high contents of immunoglobulins like IgG, IgM, vitamins, minerals and proteins. That's why it's very nutritious for the baby, and it's mandatory to give colostrum to the baby so that it protects baby from from whooping cough, from flu, all these things. It gives a protective mechanism to the baby because of the antibodies. Second most important tip is a feeding technique. So basically the baby should be placed in a comfortable position. If the mothers, they don't hold the baby close to their body, then also it's not comfortable for the baby. So that latching technique is also most important, and they should hold the baby as close to their breast as possible. Third most important tip is like putting the areola as well. Most of the individuals, most of the mothers, they usually give only the nipple. So that's when they cut the nipple and you suffer from cracked nipple. So in those cases, along with the nipple, we usually advise the lady to put the areola, the black part all around the nipple is called as areola. Even that also they should insert into the mouth so that the baby will have a mouth fullness feeling, and the more and more they suck, and the more and more milk will be produced because of the stimulation of the oxytocin hormone. So this is the third most important tip. Fourth most important one is the baby starts sleeping because they are tired of suckling the breast, because when compared to the bottle feeding, when we directly feed the baby, they need to struggle a bit so that their cheeks they'll be tired and they'll start sleeping, keeping the nipple inside the mouth. So that's when mothers usually think that the baby is satisfied, or they usually think that the breast is empty, that's why they are sleeping. No, but that is not true. And the fifth most important one is changing the breast. See, when they sleep, then you should not think that the baby is satisfied. So when the baby leaves the nipple on their own, that indicates that the breast milk is empty on that side. So that's when you need to change the baby to the opposite breast and feed them adequately. This is the fifth most important tip. Sixth most important tip is there are two types of breast milk, foremilk and hindmilk. Foremilk is thin, watery, and it is rich source of vitamins, minerals and more of proteins, and it contains more of water content. After foremilk comes the hindmilk. Hindmilk is little thick, creamish white, and it is a rich source of fat, and the baby gets satisfied only when it consumes the hind milk. So that's the reason you need to disturb the baby. As long as they are feeding, you need to rub their ears or you need to rub their foot so that they will consume both foremilk and hind milk as well. And this is the sixth most important tip. Seventh important tip is maintaining the size of the breast. Most of the individuals, they give only on one side. So one side when they feed the baby, the other breast remains bigger in size. So there will be inequality of the sizes. And the eighth most important is you need to change the breast. See, babies are just newborn babies, so they don't know which is right breast and which is left breast. So basically it depends on how comfortable position they are in. The baby's position should be comfortable, and the nipple along with the areola should be kept in their mouth so that both the breasts, they latch equally. Ninth most important is alternate sides. So once when the baby is full, when the baby feels that the breast milk got over, then they leave the nipple on their own, and that's when you need to alter the baby to the opposite breast. So this is the ninth most important tip. 10th most important tip is in spite of feeding both the sides, still the milk is, if it is excess, then you need to express the excess milk and you need to discard, or you can store it in the bottles. So friends, in this video we just discussed about the 10 most important tips in breastfeeding, and if you find it informative, please like my video and share with your friends and needy people. Thank you, and do follow us on Instagram and Facebook as well.